You may already be treating adult ADHD without realizing it. Many adults with ADHD never receive a diagnosis, not because they avoid healthcare, but because they present with anxiety, depression, burnout, insomnia, or substance use, instead of the core disorder itself. Primary care is often the first place these patients seek help. Why this matters? Adult ADHD affects approximately 4.5% of adults, making it one of the most common neurodevelopmental disorders seen in outpatient medicine. Yet many patients remain undiagnosed for years. The consequences can include impaired work performance, financial stress, relationship difficulties, emotional dysregulation, and increased risk of substance use disorders. Why primary care misses it? Adult ADHD rarely presents directly. Most patients do not schedule appointments saying, "I think I have ADHD." Instead, they present with chronic anxiety, depression, difficulty concentrating, procrastination, emotional overwhelm, burnout, or relationship conflict. The underlying ADHD is often hidden beneath these more visible symptoms. Treatment-resistant depression or anxiety should raise suspicion for underlying ADHD, especially when symptoms began early in life. Other important clues include frequent job changes, chronic lateness, unfinished projects, underachievement despite intelligence, and impulsive decision-making. These patterns are often lifelong. At its core, adult ADHD is a disorder of executive functioning. Patients commonly struggle with organization, time management, task initiation, sustained attention, and emotional regulation. This often creates chronic frustration and shame, particularly in high-functioning adults who have spent years compensating for their symptoms. What to listen for? Pay close attention to phrases like, "I've always been this way," "I could never stay organized," "I worked harder than everyone else just to keep up," or "I start things but never finish them." These lifelong patterns are often more revealing than symptom checklists alone. One of the most important distinctions in diagnosis is that ADHD symptoms are chronic and trait-like. Conditions such as depression, anxiety, or bipolar disorder are more often episodic. ADHD symptoms typically persist across multiple stages of life and across multiple settings. That chronicity is a major diagnostic clue. If a patient has persistent anxiety or depression that never fully improves despite appropriate treatment, pause and reconsider whether untreated ADHD may be contributing to the clinical picture. Missing ADHD can lead to years of partial treatment response and ongoing functional impairment. Adult ADHD is common, impairing, and frequently missed in primary care. Most patients present indirectly through comorbid conditions of functional impairment rather than obvious hyperactivity. The key is recognizing lifelong patterns of inattention, disorganization, impulsivity, and executive dysfunction. With appropriate recognition and treatment, outcomes can improve substantially. In the next module, we'll cover how to screen, evaluate, and confidently diagnose adult ADHD in primary care practice. We'll review screening tools, DSM-5 criteria, collateral history, and how to distinguish ADHD from common mimicking conditions.